Hi, so today I am presenting a holistic advocacy plan for Jaden, a 14-year-old non-binary client who has been in counseling for 6 months. Jaden initially presented with complicated grief following the sudden death of their father, with whom they had recently reconnected. In our most recent session, Jaden disclosed ongoing abuse by a family member who does not reside in the home, though they are currently unwilling to identify the abuser due to fear. This disclosure raises urgent safety, ethical, and legal considerations alongside Jaden's ongoing grief and identity-related needs. So the first thing that I think about is safety, and then also maintaining a supportive building and maintaining and protecting a strong therapeutic alliance with Jaden. So the presenting issues and needs, the first presenting issue would be safety and abuse. That's the immediate priority. Immediate needs, client safety, mandated reporting, emotional stabilization, and fear reduction. Short-term needs, building trust, increasing Jaden's sense of control, and coordinating protective supports. And then long-term needs, trauma recovery, empowerment, and restoration of a felt sense of security. Presenting issue number 2 would be the complicated grief and trauma response. So immediate needs here would be emotional containment and regulation. Short-term needs, processing grief, complicated by trauma and relational rupture. And then long-term needs, integration of loss, meaning making, and post-traumatic growth. Presenting issue number 3 would be identity affirmation and developmental support. So immediate needs here, affirmation of Jaden's non-binary identity and emotional validation. Short-term needs, strengthening support, systems and peer connection. And long-term needs, healthy identity development, resilience, and autonomy. So critical resources per presenting issue that are critical to the success of this plan would be first looking at Jaden and his safety and the abuse that's happening would be the Arizona Department of Child Safety, or DCS hotline, for mandated reporting, and also the local Child Advocacy Center for forensic and therapeutic coordination. They provide medical exams and expert coordination with law enforcement, prosecution, and child welfare for a less traumatizing investigative process. For grief and trauma, trauma-focused adolescent therapy services and community-based grief groups for adolescents who have lost a parent. And for identity and development, LGBTQ youth organizations such as 1 and 10 in Arizona, and school-based counseling and support teams. So agencies and community partners that would assist the following to help accomplish the plan would be Department of Child Safety, or DCS, for mandated reporting and protection, school counselors and administrators for academic accommodations and monitoring, primary care provider for psychosomatic screening, LGBTQ affirming youth centers for peer support and identity affirmation, Child Advocacy Center for coordinated trauma response. So details about the state board for state licensure and legal considerations in the state of Arizona. So according to the Arizona Board of Behavioral Health Examiners and state law, counselors are mandated reporters of suspected child abuse, even when details are limited. Reporting is required when there is reasonable belief, not proof. Client confidentiality is ethically limited when there is a risk of harm, consistent with the ACA Code of Ethics, 2014, Section B2A and B2E. And advocacy aligns with ACA Section A7A, requiring counselors to act in the best interest of vulnerable clients. Jaden will be informed of these limits in a developmentally appropriate, trauma-informed manner. Groups offered through community partners that would be therapeutically relevant and effective would be adolescent grief support groups, trauma-informed teen groups offered through CAC, and LGBTQ youth support groups that emphasize safety and belonging. These groups reduce isolation and normalize Jaden's experiences. Evidence-based, culturally responsive strategies to be used would be trauma-focused cognitive behavioral therapy. This would be appropriate due to abuse disclosure, grief, and trauma symptoms. It also supports emotional regulation, trauma processing, and caregiver involvement when safe. Parts-informed and attachment-based interventions would help Jaden externalize fear-based parts and grief-related emotions, and it also increases self-compassion and internal safety. Gender-affirming, trauma-informed care validates Jaden's non-binary identity and reduces minority stress and enhances the therapeutic alliance. These approaches align with best practices for traumatized, grieving, gender-diverse adolescents. Education, career, and life management strategies would be school advocacy, so collaborating with school staff for academic flexibility and emotional supports, and then life skills development, emotion regulation, boundary setting, and help-seeking skills. So these strategies promote developmental competence and self-efficacy. Ethical and legal considerations. Mandated reporting balanced with minimizing re-traumatization. Transparency about limits of confidentiality. Ongoing informed assent. Advocacy without coercion, and cultural humility and respect for Jaden's autonomy. Monitoring progress and plan modification. Progress will be basically monitored through symptom check-ins. So sleep, anxiety, affect regulation, diet, Jaden's self-reported sense of safety, school feedback and attendance, ongoing reassessment of risk, and the plan will be adjusted collaboratively as Jaden's needs evolve. So basically, this advocacy plan supports Jaden emotionally, physically, socially, developmentally, and ethically by prioritizing safety, affirming identity, addressing trauma and grief, and coordinating interdisciplinary supports. The plan promotes healing, empowerment, and long-term resilience.